So, good morning. Now we'll continue with the rest of the part of the constrictors. So, how far we have reached? We have started the layers of the pharynx, and you know the layers of the pharynx. Do you remember them? What are they? Starting from inside outwards, mucosa, submucosa with the Valdeir's ring, pharyngobasilar fascia, then the muscle layer, which consists of inner longitudinal and outer constrictors. And outer to that you find the buccopharyngeal fascia. So we started with the muscles and reached till the middle constrictor in the previous session. So in this session we'll continue with the inferior constrictors and the rest other muscles and other aspects of the layers. So now we are starting with the inferior constrictor. So you know this inferior constrictor has got two parts. One is termed as the thyropharyngeus part and the second one is the criccopharyngeus part. So look at that name. It is thyropharyngeus. So that muscle, thyropharyngeus part of the inferior constrictor will take origin from the oblique line of thyroid cartilage. Fine. And what about the second one, criccopharyngeus, that will take origin from the side of the cricoid cartilage. So the origin only is different for these two. Finally, what happens? These two muscles will go sideways and then get inserted into the median fibrous raphe. So look at that figure. In that figure, you are seeing the inferior constrictor. Are you appreciating the inferior constrictor? This is the inferior constrictor. This is the thyroid cartilage. And there you are seeing the oblique line of the thyroid cartilage. So this is the thyropharyngeus part. This is the cricoid cartilage. This is the cricoid cartilage. And that transversely running fibers there. That is the criccopharyngeus. So finally, in the center, you are seeing the median fibrous raphe. Are you seeing that? The median fibrous raphe there. It is into that median fibrous raphe. You find the muscles are coming for insertion. So in relation to the inferior constrictor, you already know it has got two parts. One more term that you should be familiar with the inferior constrictor, and that is what is termed as Killians dehiscence. So what is the Killians dehiscence? It is actually a gap between the thyropharyngeus and the criccopharyngeus part of the inferior constrictor muscle. Okay, so we'll go to the figure so that you will appreciate more of Killians dehiscence. So look at that figure. You are seeing thyropharyngeus there. This is a thyropharyngeus. This is the criccopharyngeus. And that gap in between, it's marked there. And that is what is termed as Killians dehiscence. So why are we so bothered about this Killians dehiscence? It is because of some applied aspect in relation to the Killians dehiscence. What is it? In case of a neuromuscular incoordination, suppose a neuromuscular incoordination occurs and you have a raised intrapharyngeal pressure, then what happens is it is through this Killians dehiscence, the mucosa and the submucosa will bulge outside the pharynx so as to produce a diverticulum there. And that diverticulum is what is termed as Senger's diverticulum. Okay, so you should be able to remember Killians dehiscence, and when an intrapharyngeal pressure is increased, you get what is termed as Senger's diverticulum. Then what is this globus hystericus? It is a lump in the throat sensation which occur due to sudden contraction of criccopharyngeus as a result of fear. So that sudden fear, will produce a lump in throat sensation because of the contraction of the criccopharyngeus muscle. That is what is termed as globus hystericus. So with that we finish the constrictors. Now we are proceeding on towards the structures between the constrictors. So in this part you should be able to know what are the structures which is passing first between the base of the skull and the superior constrictor, then between the superior constrictor and the middle constrictor, then between middle constrictor and inferior constrictor, and finally below the inferior constrictor. So shall we start with each? Okay. So look at that first one. Name the structures that is passing between the skull and the superior constrictor. So that region is what is termed as sinus of Morgagni. Between the base of the skull and the origin of the superior constrictor, you find a gap, and that is what is termed as sinus of Morgagni. And one thing we mentioned in this region, do you remember that before? We already told you that the pharyngobasilar fascia will be very thick in this region. So now we'll look what are the structures which pass through this. There are 4 structures. Look at that. First is auditory tube. Second one, levator palatine muscle. And then you get 2 arteries. One is ascending palatine artery and the other one is the palatine branch of ascending pharyngeal artery. So 4 structures, name them. One is the auditory tube, 2 levator palatine, 3 ascending palatine artery, and 4 the palatine branch of the ascending pharyngeal artery. So these 4 structures which is present or passing through the sinus of Morgagni will pierce the pharyngobasilar fascia and then enter inside. Fine. So now look at the structures that is passing between superior and middle constrictor. So just remember you find 2 structures. One is stylopharyngeus muscle, and this stylopharyngeus is supplied by glossopharyngeal nerve. So these 2 structures, stylopharyngeus and glossopharyngeal nerve. Have you heard this term before, this muscle before, stylopharyngeus? Where? Yes, it is in relation to the longitudinal muscles of pharynx. Do you remember the 3 longitudinal muscles of pharynx? Out of that, one was stylopharyngeus. So stylopharyngeus and glossopharyngeal nerve which supplies it will pass in the gap between the superior constrictor and the middle constrictor. So now look at that figure. Look at that figure. You are seeing the superior constrictor marked there. This is a superior constrictor. This is the middle constrictor. Are you seeing that? Middle constrictor. In the gap between these 2, you are seeing stylopharyngeus. Are you seeing that? Between the superior and the middle, you are seeing the stylopharyngeus with the glossopharyngeal nerve. So is that clear? Fine. So now, what are the structures which pass between the middle and the inferior constrictor? 2 structures again. One is superior laryngeal artery and the other one is internal laryngeal nerve. So superior laryngeal artery and internal laryngeal nerve. So look at that figure again. You are seeing the middle constrictor. This is the hyoid bone. This is the hyoid bone. And from the hyoid bone, you have the origin of the middle constrictor there. And then below that, you find the inferior constrictor. And so that gap between these 2, this is the region where you find these 2 structures are passing. Name them. That is the superior laryngeal artery and internal laryngeal nerve. Now can I ask you something? Have you heard these 2, one artery, these 2 structures, that is one artery and one nerve, anywhere else? Where did you hear it? When we were discussing the anterior triangle, you were taught about a thyrohyoid membrane. Do you remember that? Thyrohyoid membrane. And you were asked what were the structures which pierce the thyrohyoid membrane. What were they? They are these 2. Superior laryngeal artery and internal laryngeal nerve. So this superior laryngeal artery is a branch of what? It's a branch of superior thyroid artery. And this internal laryngeal nerve is a branch of what? It is a branch of superior laryngeal nerve, which in turn is a branch of vagus. Do you remember that? Vagus is the 10th cranial nerve which you find in the carotid sheath. Within the carotid sheath gives many branches in the neck. One branch is the superior laryngeal nerve. that superior laryngeal nerve will divide into an external laryngeal nerve and internal laryngeal nerve. That external laryngeal nerve will go to supply the cricothyroid muscle. The internal laryngeal nerve will pierce the thyrohyoid membrane in between the middle constrictor and the inferior constrictor, and then it enters inside the larynx. It is internal laryngeal nerve. So after piercing the thyrohyoid membrane, it is entering inside the larynx so as to give sensory innervation there. Okay. So that is how you get these two structures there. Now we come to the last part, the structures passing below the inferior constrictor. Remember these two, one artery, one nerve. Which artery? It is the inferior laryngeal artery and recurrent laryngeal nerve. So this structure, you are seeing this structure, that will be roughly corresponding to the tracheoesophageal groove below the inferior constrictor. There you are seeing the recurrent laryngeal nerve plus your inferior laryngeal artery. So with that we finish the structures passing in between the constrictors. I think you are familiar with all those things. Okay. So look at that figure. What are you seeing there? Which bone is this? This, that's a hyoid bone. Which is this? That's a thyroid cartilage. What is this? That's a cricoid cartilage. Can you identify the muscle here? What is that muscle? That is a cricothyroid muscle. Fine. This structure is corresponding to what? That is a thyrohyoid membrane. Good. So what is this nerve that you are seeing there? That is the internal laryngeal nerve. You see internal laryngeal nerve is piercing the thyrohyoid membrane and entering. What is this nerve? That is external laryngeal nerve which is going and supplying cricothyroid. What is this nerve? That is the recurrent laryngeal nerve which you find below the inferior constrictor in the tracheoesophageal groove. What is this nerve? That is a superior laryngeal nerve which in turn is a branch of vagus. So all those nerves and their locations are clear to you now. So shall we proceed? Okay. So with that we finish the structures passing and the constrictors. Now we go on towards the longitudinal muscles. So 3 longitudinal muscles are there. Sorry. Name them. One is the palatopharyngeus, 2 salpingopharyngeus and 3 stylopharyngeus. So these are the 3, palatopharyngeus, salpingopharyngeus and stylopharyngeus. So look at that figure. In that figure you are seeing the soft palate here. This is the soft palate. This is the soft palate, and from there by 2 fascicles, by anterior and posterior fasciculus, you find the origin of the palatopharyngeus. Are you familiar with this palatopharyngeus anywhere else? Where was it? That was in relation to what? Pessavent's ridge. Do you remember that? Pessavent's ridge. Okay. So this Pessavent's ridge, which contributes in the formation of the nasopharyngeal isthmus, is mainly contributed by the palatopharyngeus with few fibers from superior constrictor. Okay. So that is the first muscle, palatopharyngeus. Second one is salpingopharyngeus. So anywhere you hear or you see a muscle starting with salpingo, it will be very closely related to auditory tube. Fine. So this is the auditory tube. This is the auditory tube here, and you find this is the salpingopharyngeus muscle. Fine. So these 2 muscles we have discussed. One is palatopharyngeus and second one is salpingopharyngeus. Where have you heard the third muscle, stylopharyngeus? Just remember that it was that muscle which was passing in the gap between which 2? Superior constrictor and middle constrictor. So now we have finished 3 longitudinal muscles. So when you view these 3 muscles, what is the common or what is the feature you note for these 3 longitudinal muscles? One is stylopharyngeus, the other one is palatopharyngeus, other one is salpingopharyngeus. The thing is, the origin for 3 muscles are different, as indicated by the name. Stylo means from the base of the styloid process. from palatopharyngeus means it is from the palatine aponeurosis by two fasciculus, anterior fasciculus and posterior fasciculus. Then the third one was salpingopharyngeus. So that is from the cartilage part of the auditory tube. So one thing you have to remember is the origin of these three are different. These three muscles are different. Insertion is into the posterior border of thyroid cartilage. All these three will join together and finally get inserted to the posterior border of thyroid cartilage. So with that we finish the constrictors and the longitudinal muscles, and now we come to the action of the pharyngeal muscles. So read that. The contraction of the constrictors, that is except cricopharyngeus, will propel the food into the esophagus. So when the constrictors are acting, the longitudinal muscles are relaxed. And once the food has entered the esophagus, then the longitudinal muscle will contract so as to bring the pharynx to the original position. So that is the action you get. Okay. What is the action? First you find the contraction of the constrictors except cricopharyngeus, and then what happens? The food now reaches from the pharynx, it is proceeding on towards the esophagus. So when these constrictors are contracting, you find a relaxation of the longitudinal muscles, and once this bolus of food has reached the esophagus, then you find the longitudinal muscles are contracting so as to bring the pharynx towards the original position. So now we finished the muscles, and now we are going to the last layer, that is what is termed as buccopharyngeal fascia. So this buccopharyngeal fascia is covering the pharynx externally. And you know the pharynx is a fibromuscular tube. It has got several covering. The last covering is the buccopharyngeal fascia. So still outside, outer to the buccopharyngeal fascia, you find a space. That space is what is termed as retropharyngeal space. Look at that name. It is retropharyngeal space. That space which lies behind retropharyngeal. So retropharyngeal space you find lying in between this buccopharyngeal fascia and the prevertebral fascia there. What is prevertebral fascia? Behind you find the vertebra. In front of that you find the prevertebral muscles covered with this prevertebral fascia. So between the prevertebral fascia and the buccopharyngeal fascia you get the first space, and that is the retropharyngeal space. So look at that figure. In that figure you are seeing vertebra here. This is the pharynx continuing down as esophagus, and you are seeing orange colored structure, that is a prevertebral fascia. Then you are seeing a green colored structure, that is the buccopharyngeal fascia, and in between that you find a space on either side, and that is what is termed as retropharyngeal space. So now we come to the nerve supply of the muscles of pharynx. So we are talking about the motor supply of the muscles of pharynx. So always remember this statement. All the muscles of the pharynx is supplied by pharyngeal plexus except stylopharyngeus, which is supplied by glossopharyngeal nerve. This statement should be there in your mind always. All the muscles of the pharynx is supplied by the pharyngeal plexus except stylopharyngeus, which is supplied by the glossopharyngeal nerve. Okay, so that is a very rough statement I have mentioned. Some more details of that you should be able to say. Can I say that? Okay. So remember, this inferior constrictor already has a branch coming from the pharyngeal plexus. In addition to that, it gets supply from external laryngeal nerve and also from recurrent laryngeal nerve. So this external laryngeal nerve will be going to supply the thyropharyngeus part, and recurrent laryngeal nerve is supplying the cricopharyngeus part. All the muscles of pharynx is supplied by pharyngeal plexus except stylopharyngeus supplied by glossopharyngeal nerve. This inferior constrictor gets two more nerves. One is recurrent laryngeal nerve, the other one is external laryngeal nerve. So I was using the term pharyngeal plexus. Pharyngeal plexus, what is it actually? So look at that. This pharyngeal plexus is mainly formed by the pharyngeal branch of vagus carrying fibers from the cranial part of the accessory nerve. That's the most important thing. So in pharyngeal plexus, you find the pharyngeal branch of the vagus carrying fibers from the cranial part of accessory nerve. Along with that, you get a contribution from the pharyngeal branch of glossopharyngeal nerve plus a fiber coming or a sympathetic fiber coming from the superior cervical ganglion. So these four counterparts are there in pharyngeal plexus. Out of this, the most important one is the pharyngeal branch of the vagus, which carries fibers from the cranial part of accessory nerve along with the pharyngeal branch coming from the glossopharyngeal nerve along with the contribution from the sympathetic chain. So now you are able to remember what is pharyngeal plexus, how is the pharynx, muscles of pharynx getting its nerve supply from, like that. Okay. One more thing in pharyngeal plexus that you should remember is this pharyngeal plexus will be more pronounced on the outer surface of the middle constrictor. You find such a very well formed plexus just behind the middle constrictor. To be more specific, it is in between the middle constrictor and the buccopharyngeal fascia. You find such a plexus there. Fine. So now we come to the arterial supply. Read that. You find a large number of arteries supplying it. It's very easy to remember it. How you remember it? The main artery, all these branches are coming from external carotid. So external carotid gives one branch, that is the ascending pharyngeal branch. So directly branches from the ascending pharyngeal, which in turn is a branch of external carotid, will go and supply the pharynx. External carotid gives three more branches. One is lingual artery, two is facial artery, and three, it's a terminal branch of external carotid, and that is what is termed as maxillary artery. So these four arteries, ascending pharyngeal artery, lingual artery, facial artery and maxillary artery, will supply the pharynx. So what all branches of these? So first one from ascending pharyngeal. Second one from ascending palatine and tonsillar branches of facial artery. Then dorsal lingual branches of lingual artery. And finally the greater palatine and the pharyngeal artery of maxillary artery. So these are the four main arteries which supply the pharynx. So look at that, you are seeing the external carotid artery there. The external carotid artery giving ascending pharyngeal, branches coming from the facial, branches coming from the lingual, and finally from the maxillary artery. So with that we finish the arterial supply. Now we come to the venous drainage. The venous drainage, veins finally drains into the pharyngeal venous plexus, and this pharyngeal venous plexus will finally drain into the internal jugular vein. Fine. So venous drainage finally to internal jugular vein. What about the lymphatic drainage? The lymphatic drainage is mainly to upper and lower deep cervical nodes. Now we come to the last part here, and that is the pharyngeal spaces. We already mentioned one space. Do you remember that? One is the retropharyngeal space. Look at that figure. What are you seeing? You're seeing pharynx here. Are you seeing pharynx? Then this is the prevertebral fascia. The outermost covering of the pharynx, there you see the buccopharyngeal fascia, and on either side of the pharynx, behind the pharynx, you are finding the retropharyngeal space. Behind the pharynx, retropharyngeal space. And one more space is there, and that is what is termed as parapharyngeal space. You find it lying on either side. Para means on either side of the pharynx. So look at that. This whole structure, this is the pharynx. Behind you are seeing the retropharyngeal space, and this is the lateral part. There you are seeing on either side you are seeing the parapharyngeal space. So with that we finish the layers of the pharynx, and I think I'll stop here, and in the next session we'll deal with the interior of pharynx. So that much is clear to you? So shall I leave? Okay, thank you.